When we talk about mental health, we typically tend to label the person as having the problem. When we talk about brain health, we look at the system that is causing the problem. And a lot of people ask me, what is the difference between mental health and brain health? Mental health is very much focused on you having a problem. It's focused on the symptom clusters that lead to a diagnosis that you personally have a mental health struggle. Brain health looks at your whole brain, your genetic makeup. It looks at your biological, psychological, social and spiritual health. It looks at your brain as a connected system to the rest of your body. It looks at your brain as the engine that runs your body, which is exactly what it does. And it focuses on helping you optimize your unique brain so that you don't just feel normal, but so that you can feel extraordinary, and optimize your brain to get the best out of you. Children are so accustomed now to the context of mental health, to the label that mental health has associated with it, that they're no longer labeling their emotions as actual emotions, but they're labeling them with diagnoses of a condition that they say they think they have. I'm stressed, I'm depressed, I'm anxious. The very nature of calling it mental health, and the word mental really attaches a strong stigma to it for our children, and we can't get away from it until we break the word and the association of the diagnosis with the root cause of the struggle. And it's really important, we owe it to our children to break the stigma, to look at focusing on how we can reframe the conversation to one not of mental health, but one of overall brain health, so that we can focus on understanding the root cause of the problem and address the root cause, rather than treating the symptom with drugs that leads to long-term dependency. Back in 1998, in fact, I was actually struggling with really bad dandruff, and I didn't really know what the root cause of it was. And I went to my doctor, and he said, I think you're stressed. I can prescribe you with some antidepressants, and that will hopefully take away the symptoms. I was shocked. Here I was, 21 years old, and I was being prescribed antidepressants for something that I knew I could uncover the root cause of and fix the root cause. And I was hoping to go into the military at the time, so my opportunities would have been squashed. My whole life career ahead of me would have been changed had I chosen to go down the route of antidepressants. And it was a simple fix. I focused on understanding what the root cause of my stressors was, which was actually not getting enough sleep and taking on too much. And once I fixed those, that dandruff that I was having, that chronic dry scalp condition, went away, and I didn't need any drugs, I didn't need any treatment, and I didn't have any long-term dependency on something that was ultimately masking the symptom and not dealing with the root cause. So it's really important that we take the time to invest in the right things, in the right education, in the right training to help our children and to help adults, parents, caregivers, teachers businesses better understand how our brains work and learn how we can optimize our brains so that we can curb the massive rise in mental health issues, so that we can curb the diagnoses of stress, anxiety and depression, so that we can help our children, so that we can empower our children and the next generation to learn how they can take back control of their health and well-being, how they can manage their unique brains more effectively and deal with the root cause of the issue rather than masking the symptoms with drugs. Did you know that there are 7 different types of depression, and it depends on your brain type as to what type of depression you have? And indeed, depression can be caused by a multitude of different things, including Lyme's disease. If we don't treat the Lyme's disease, we are never going to treat the root cause of the depression, and that is treated simply with antibiotics. And if we don't, and also depression can be caused by head trauma, and that's one of the fundamental problems that lies undiagnosed in terms of chronic brain health struggles. The fact that our multiple minor knocks can have a huge consequence on our brain health. And in fact, I know myself, having had my brain imaged, that my multitude of little knocks that I've had throughout my life has actually damaged the temporal lobes in my brain and making me more susceptible to depression. But had I not known that, I wouldn't have the tools and techniques that I have now to make sure that I optimize and balance my unique brain. So what 3 steps can we take? Well, the first thing is that we need to stop talking about mental health in the context of the labelling, in the context of focusing on the person as having the problem, and we need to start talking about brain health and well-being and connecting the fact that our brain runs everything in our bodies, and when we focus on optimizing our brain, we can help ourselves balance our brains and make sure that we reduce and minimize the risk of any long-term mental health struggles. And thirdly, we need to start looking at the organ that we treat. The medical profession in psychiatry is the only medical profession that doesn't actually image the organ that it treats. It still continues to this day to follow a same policy that adopted about 150 years ago and guesses on what the root cause of your problem is based on symptom clusters, and it's very much focused on treating the symptom rather than treating the underlying root cause, and you don't know what the problem is unless you look. This is the equivalent of going to a hospital and saying, I think I've broken my leg, and the specialist doesn't actually bother to look to see whether your leg is broken, even though it looks completely misshapen, and says, here you are, have some very strong painkillers, hopefully that will mask the pain and eventually it will go away. That is ridiculous, but that is how we are currently diagnosing people from a psychiatry perspective, and it needs to change. It is negligent not to be looking at the organ that we are treating and not to be understanding the root cause of the problem. If you'd like to find out more about how I can help you unchain your pain, unlock the secrets to greater mental clarity and performance, and unleash your full potential, and you would like a unique brain health evaluation with reach back to specialists that actually image the organ that they treat, and that is the brain, then make sure you register yourself for a free Unleashed strategy call to find out about how I can help you. If you loved this video and would like to learn more, then make sure you click on the link in the top right hand corner to watch the next one in the series. I look forward to talking to you very soon.